Haiti, a beauty in the Caribbean. But its capital, Port-au-Prince, is built on one of the most dangerous earthquake fault lines. The weekly market in Rousseau, a small town some 60 kilometers from the capital. Whatever is sold or bought here has to be carried from steep and unforgiving mountains that rise near Rousseau. This is where Jean Cameau Audon lives. He is poor, but hard-working and resilient. That is how he, like most people in the mountains, survives. But up until a few years ago, survival also depended on a simple fact: don't get sick. There is no doctor and no hospital out here. My sister fell sick with typhoid sometime before the hospital of OSAPO was built. We had to walk by foot with her for 4 hours to reach a car to bring her to the hospital. But then it was too late and she died. Today, Jean's sister could have been treated here. Since 2008, OSAPO has opened a clinic in the middle of the mountains. It serves some 50,000 people who often walk for hours to reach the clinic. Jean's sister would have been cured here. The little hospital was built after a mobile clinic set up by OSAPO was immediately flooded with patients. This has not changed. In 2010, a huge cholera epidemic also affected the area of Rousseau. The clinic treated thousands of patients in over 1 month. This experience changed the course of OSAPO.
Because the cholera showed us how the Haitian people, especially living in the remote area, they are so vulnerable. Vulnerable in terms of hygiene, for example. People doesn't have any knowledge about the hygiene promotion, how to really taking care by themselves, how to protect themselves, how to keep the environment clean, you know, to have a better living condition in the area.
The OSAPO team immediately sat down to work out how they could contribute to reduce the vulnerability of the population. Many diseases are spread by contaminated water. The river looks clean, but it is not. Clean water and sanitation were first on the list. A huge water tank was built to supply at least the area around the hospital with clean water. The next step happened in meetings like this. Health educators from OSAPO spread out into the most remote settlements to teach people how they can take responsibility for their health. One very effective way: build latrines and use them. After learning about the importance of hygiene after using the latrines and how to make the latrines safe for children, people are selected to receive materials and instructions for building their own latrines. Stones are picked up at the clinic and carried up into the mountains. Today, more than 300 latrines have been built and are used in the area, and the infection rate has dropped dramatically. Claudette Petit's child represents maybe the biggest challenge for OSAPO: malnutrition. There are so many malnourished children that the clinic had to start a special emergency program. Severely malnourished children are carefully monitored and given nutritional supplements based on peanut butter. But that is not a long-term solution. Once again, OSAPO looks beyond the medical emergency and expands its course of action.
We have been working in the community. We learn something. Every day we learn something. And by what we learn in this community, we figure out now we have to go further than primary health care.
To get here from the clinic is a 4-hour hike. This is where Claudette Petit lives with her malnourished child. Today, the father takes care of the handicapped boy. Karine, a nutritional nurse from the OSAPO team, has come up to find out why the child of a farmer is malnourished. She asks about what he grows and what they feed the children. It turns out that the father grows a number of healthy vegetables and fruit on his land. But nevertheless, all of the 4 children are not well nourished and therefore prone to illness.
They have all the food here, but they don't really know the nutritional value of each of them. They don't know how to use it and when to use it, and the benefit of it for each of the kids and even for themselves. OSAPO is going to make a class for all those people. When they come, they will know what to plant, when to plant them, and when they get them, the nutritional value of each, and they're going to have to cook what they have to present to the kids and to themselves. I'm confident about it because we have experienced so many different projects with those people in any other kind of situation, and they usually do it.
The most convincing part of the lesson about nutrition comes from cooking a delicious meal. Working on issues of nutrition in the villages, the OSAPO team soon came across another reason for the lack of healthy food. There is not much knowledge about efficient planting techniques. Consequently, OSAPO has established a big community garden to teach people how to grow food more effectively, especially those vegetables which people can use to feed their children and themselves in order to reduce the risk of malnourishment. Since some time, OSAPO offers young mothers the opportunity to deliver their babies in the clinic. Luckily, this mother is well past her teenage time. This is another goal of OSAPO's preventative health strategy.
We are working hard to get a delay of the age of the first pregnancy. And our work is also on the youth. We work with the youth to change their mind and their behavior, the sexual behavior.
This has never happened before. 2 grown-up women were talking to them about sex, about anatomy, pleasure, risks, and responsibility. But only if there is room for an open and educated information and discussion can these young people be reached and be convinced to be careful. The risk of HIV looms heavily over Haiti. That's why this lesson ends with the delicate topic: always carry a condom and know how to use it. Most babies in the region of Rousseau are born at home. Traditionally, they are taken care of by a matrona, a midwife. Maturine Bien-Aimée is a matrona. For more than 25 years, she has crossed the never-ending mountains to take care of pregnant women and help them deliver their babies. Just down the slope and then up again is where her next customer lives. Reen asked the young woman if she has eaten today. It is almost noon. The pregnant woman says no. The midwife knows that most people here are too poor to have enough to eat. Then she checks the baby. At least here, everything seems to be okay. While she washes and later on massages the expectant mother, the midwife points out how important personal hygiene is for the mother and the baby, and most importantly, that the mother has to eat in order to be strong for the birth. Although the matrona has worked many years in her profession, she is grateful to OSAPO for receiving additional training in the clinic. I learned from OSAPO how to disinfect the umbilicus of the newborn, how to give the baby eye ointment, and how to facilitate the birth of the placenta. In the clinic, there are regular training sessions for matronas and also male birth attendants, which are quite common in Haiti. This teacher has received her training from the Ministry of Health, with whom OSAPO cooperates closely. Since the opening of the clinic in 2008, the level of medical services has increased tremendously. Today, the OSAPO team has a fully equipped operating room. Here, the people of the region from Rousseau can get the same medical care as in expensive hospitals in the capital. But the team of OSAPO is proud about quite a different achievement.
After 5 years now, and I can see that change. People doing something by themselves to keep them safe in the community, to keep them away of any type of diseases in the community. I think it's a good thing because that is the dream, long-term dream of OSAPO. Resilience. I mean, people really doing some work by themselves to do something for themselves. That's the things.
Meanwhile, the hospital is expanding. OSAPO is building a maternity ward and a nutrition center to do follow-ups of the malnourished children and to provide nutritional workshops for mothers and pregnant women. This needs reliable partners. One of the most important is Miriam Spey. She coordinates the activities of Action Medior in Haiti. The big German NGO concentrates on building long-term, self-sustained and local medical structures. Action Medior has committed itself to OSAPO for the long haul. We share the same idea of a comprehensive and long-term health care. We support many projects of OSAPO because they focus on prevention. I really enjoy working with OSAPO because it is always very productive. What we have achieved so far was made possible through the support of our friends. For that, we are very grateful and confident that we will continue this cooperation in the future. We are looking forward to continue working with you to provide access to basic health care to the population in rural community in Haiti.